thank you everyone for joining us today. Really excited for this conversation. To get us started, most importantly, would love for each of you to introduce yourselves to the audience, yourself and the mission that you're working on. Romy, I'll start with you first.
Hi, I'm Romy Antoine. I'm the co-founder and CEO of One Stop Wellness, and we're a digital health literacy platform that's creating health equity in the workplace and helping employees make better decisions to further advance increased health outcomes.
Great, thank you. And Jeff?
Hi, I'm Jeff Wandzura. I'm the CEO at Keep Labs. I'm a pharmacist by trade and previously founded and sold 2 digital health ventures. At Keep Labs, what we're doing is connecting patients and pharma to the specialty medication management journey in the home. And by passively capturing information, what we're allowing our partner organizations to do is action real-time, passively capture data to target intervention on a very personalized and timely basis.
Thank you. Drew?
Good afternoon, everybody. My name is Drew Mercer. I'm the co-founder and CEO at PayGround. We are changing the way patients pay for healthcare. So we empower patients by providing them a mobile app, the PayGround mobile app, and which allows them to pay all their medical bills in one place. And at the same time, we tie into the billing systems for providers, whether that's at the ambulatory level or at the acute level, and real-time reconcile. So just making the revenue cycle more efficient around payments.
Great. Richard?
I'm Richard Hanbury. I'm CEO of StartUpHealth. This is our device. We're an audio-visual neuromodulation device. So the user puts it on, turns it on, and then with pulses of light and pulses of sound, we're essentially an anxiety relief on demand device. So we have applications across almost every area of pain and mental health. Currently going through pivotals in fibromyalgia at Duke and neuropathic pain at Mount Sinai. Just got a DoD grant for PTSD and another one for pain and sleep. So lots of different areas where we're hoping we can be an input in people's lives.
Absolutely. Thank you all. Jeff, going to start with you with a question. Can you talk to us a bit about the last 2 years, both the pandemic and as well as we're continuing to deal with the opioid crisis? Can you talk to us a bit about, at Keep Labs, what you guys have seen as the biggest lessons learned and key takeaways from the last 2 years and the convergence of the many factors that are in our world today and how that's affected you?
Yeah, so I think the biggest takeaway over the last couple of years has been connecting with the patient, really empathizing with the journey that they're on. So when it comes to, again, the pandemic and being able to really understand what that day-to-day journey is for the patient, we have to understand that we don't want to change, the workflow from a pharmacy level, from a patient process, but still have the ability to monitor how the medication is being utilized in the home. So what we started to do as a new initiative at Keep is what we defined as a mile in their shoes. So we've each individually picked a disease state, become experts in the field, and really started to understand what that dosage pattern is, what the challenges these individuals have on a disease state or therapy-specific basis. And through this empathy, what we've been able to do is really drive, again, how we drive that product development forward. So through this, again, changing as little bit about the medication process as we can, but still having the ability to track this and action that data with the different types of stakeholders that we're working in. So one being opioid use disorder with methadone, Suboxone, and some other molecules that are prone to abuse, and also in the specialty category. So we've really broadened our focus to not only say, again, harm reduction at the top level, how do we make a meaningful impact on, again, steering those conversations to a more positive one that we can create a safer environment, but also in the specialty class for biologics and the other high-cost meds where they're no longer being administered strictly in a clinic or a hospital setting, but in a home-based environment. And that's really kind of where we transitioned over the last couple of years. Great,
thank you. And Romy, from you on the employer side, how have you seen employers engaging with their employees in the change to virtual and remote work? What are from your end, what are the key takeaways and what do you kind of see as the biggest opportunities moving forward?
Yeah, so in the workplace wellness industry, a lot of the vendors were offering a mix of on-site services, whether it be health coaching, fitness classes, and nutrition classes, as well as their digital platforms. So once everyone switched to remote work, a lot of employees were missing that aspect of their wellness program, and they were looking for new ways to do things, especially while at home. So that gave us an opportunity because now we were also doing a lot of the on-site programming, but we started talking to more and more customers that were requesting video classes. So we were able to get a contract by making a few video samples, producing the studio, And then from there, we realized there's a bigger need for it. So our pivot was to start creating health literacy content. So not just telling people you have to do 5,000 steps a day, you have to have a certain cholesterol level, but now we're teaching them, okay, here's the recipes and foods you should eat to lower your blood pressure, or here's a 10-minute meditation you can do if you're under a lot of stress. So producing that content has helped us tremendously, because now we're getting more and more clients who are looking for these videos. And we found it as a new stream of revenue, because not just selling our platform as a whole, but we also now license our videos to our competitors, as well as we're looking to start partnering with the insurance carriers.
Great. Awesome. Thank you. And Richard, from you, as you're looking ahead now, and the different go-to-market strategies you have in front of you, where do you kind of see as your biggest opportunity? What are the key focuses that you have at Sana Health in the shorter term here? We'll get to long term in a second, but the next 6 months or a year.
So fibromyalgia is our go-to-market on our first one, and then neuropathic pain is our second. Fibromyalgia affects 10 million Americans, 85% women. It's been an area with great inequity health-wise. It gets labeled as the crazy women's disease, for example. So being able to help in that area is our focus for the next 6 months. We've got the largest non-drug fibromyalgia study ever being done. We've completed the first 76 people, and we're about to do the next 300. And so far the results are better than any of the drugs by quite a long margin. So,
Great, thank you. And Drew, for you, I think oftentimes when we think of payments in healthcare, it's a huge, massive question, topic. Where do we even start? But if you can speak to the audience today, what is something, and going with the basis of we're all in healthcare and we're here at this conference, but what is something that the audience may not know that you'd love for them to have a better grasp on, a better understanding of from the payment side of things?
Yeah, so speaking to healthcare folks, it's we're all family. So I think as a community, we've done a really good job clinically on our interoperability side. But I think one thing that we can all agree on is on the financial side of revenue cycle, things are still extremely fragmented. And so there's a lot of great solutions out there that are kind of in the same stratosphere as a PayGround, but where we really help is aggregating for the consumer, for the individuals, for the families. I got a wife, I got 4 kids, we got a lot of medical bills. So we're going to a lot of patient portals, writing lots of checks. And so a PayGround is very helpful for us, and I imagine for others, that allows them that one-stop shop to manage all their bills in one place.
I have just myself, and I also have a lot of bills too. I can't imagine what that is 5 times. Okay, and would love to, the second half of this panel, I have 2 questions I'm gonna ask each of you. The first one being, if there's an ideal collaborator or partner, a specific ask you have for them that you could work with, what is that? Who is that ideal partner, and what's the ask? Richard, we'll start with you.
The first one, as always, is fundraising. We've got 5 clinical trials going on. We should be going from 0 FDA approvals to 3 in the next 12 months. So we're currently raising a bridge round. Half of that's been filled by internal investors, and now I'm looking out for external investors. And then beyond that, it's really all the people who have apps and platforms that are identifying who can't be helped by that app and platform. So all the people doing anxiety, depression, all those on CBT-based apps, we're looking to be their tier 2 treatments. So currently, the numbers of psychologists and psychiatrists are actually declining, whilst mental health problems are accelerating. And the apps are helping a lot of people on the top level, and then we want to be that tier underneath. So anybody who's aggregating a very large number of people who have anxiety, depression, or pain issues, who can't treat them and looking for that next treatment, those are the people we want to talk to.
Great, thank you. Drew?
Yeah, so I'll put an umbrella over this. If you accept payments, we would love to talk to you. But in the spirit of focusing on everyone, get you know one, I would say really where we are seeing the best success is in the ambulatory provider markets. There's a lot of antiquation in that area. We do, serve the acute markets as well, but I think we can provide the most help in the ambulatory setting at this point. And so if there was an ask, it'd probably be in that market.
Great. Jeff?
Yeah, and from our standpoint, really what we're starting to focus in on is the specialty medication journey. So over the last couple of months, we announced a partnership with Mckesson Canada. And what this allowed us to do is start to have, again, not only the so what factor of measuring the doses on a daily basis in a more frequent passive way, but also actioning this data in a way that is meaningful to the providers, to the HCPs, and ultimately the patients that we serve. So anyone who has an involvement, a touch point with specialty medication, this could be a hub service, a patient support program, or a life sciences manufacturer themselves. That's really our target area over the next few months. And again, we do see significant opportunity when it comes to establishing a footprint within the payer landscape. But as of right now, again, the specialty, and if you want to really go down a level deeper into the therapeutic categories that have pulled us in the direction is neurology, with a particular focus on MS, oncology at home with a variety of different therapeutic areas or doses of administration, so whether that be an auto-injector, pre-filled syringe, or oral tablets. And lastly is rare and orphan conditions. So if you think about the challenges that not only the patients, the family members, and folks in the care team have on logging and administering and keeping people up to speed on what the progress is of that medication management journey, those are the folks that we want to connect with.
Great. Romy.
And for us, we're really looking to start working with health carriers and organizations that are supplying the insurance, because one thing, by going through the employers, they all have to offer insurance to the employees. But if we can start working directly with the carriers, we've learned that a lot of them still have issues with engaging their members and looking for tools to get them to start understanding how to use their medical benefits, how they can make the better choices to reduce potential health risks. So we've been really starting to have these conversations to discuss how we can boost that engagement level. And also what else we've been doing was looking at some public health and community health organizations, because due to COVID, we realized there was a bigger need for engagement, but through health equity. So most people think just because you're in a company and you have the same insurance, you have the same health care, and you have the same access to the same resources. And we found that, for example, let's say someone can't get to the gym and the doctor tells them to work out at home. But if you live in a neighborhood where it's not safe to go outside to exercise, that's a problem. So giving them other resources and tools to really help them. And I think that would really take it to the next level and equal out the playing field.
Great, thank you. And my favorite question to end on here is, as we wrap this up, favorite thing to ever ask a founder, if you could wave a magic wand 20 years from now, how is the world different because you and your solution exists? Romy, we'll start with you.
In 20 years, our goal is really to create wellness communities throughout the country as well as the world. So our plan is to start gathering enough data where we can find out different profiles based on people's health risks, their lifestyle, and then connect them to other people with similar health risks, and then show them exactly what one person has done. And by building that community, we start to create more conversations around health and increase self-literacy, get people really talking about it and really understanding how they can become their own healthcare advocates.
Bringing people together is so important. Jeff.
Yeah, so if we paint the picture forward 20 years, a key what we're trying to do is redefine what the medication management journey is. And a term that we recently coined is friction-free doses. So if you look at the traditional adherence measures today, it's very episodic and it's retrospective. So you're looking at proportion of days covered, or what's typically seen as when you pick up your medication from the pharmacy and when that next refill is due. In between those two events is a black box. So what we're trying to do is illuminate those activities in the home for our partner organizations and better understand when and how healthcare professionals and other individuals involved in their care can better target their interventions and turn from a reactive type of scenario into a proactive means. So ultimately, again, making a substantial impact on the 250,000 deaths per year that are preventable due to medication non-adherence.
Drew.
And I love StartUpHealth and their chase of the moonshot. And so our moonshot at PayGround, I would say, is twofold. One, the net effect of allowing people a simple way to pay their medical bills just increases happiness, I think, in people's lives. But also the amount of money that is spent for providers, any level of healthcare ecosystem to chase revenue is expensive. So if we can help in bringing down the cost of care by making it just simple, that would be really, really meaningful for the team at PayGround.
Love it. And Richard, bring us home here.
Well, I think we are going into a golden age of neuroscience, which is basically going to be brought about by the massive increases in imaging that's happening. And it means that companies like Sana will be able to do research on things like Alzheimer's that currently would take 20 years and $100 million. We'll be able to do that in 6 months and $1 million or $2 million. So I do think that in the next 20 years, we're going to see the end of a whole bunch of neurological disorders. I think we are going to be moving towards a situation where the social determinants become the biggest thing to solve, not the thing that's adding on to the underlying problem, because we will have the ability to solve the underlying problem, and then we'll be working on social equity and improving life for people outside of it. And that's what we want to be part of. So when you first start seeing people use contact lenses for AR and VR, we want to be in that, so we are providing the stimulation that your brain needs to get you into a relaxed state. All those kind of things. Star Trek is just around the corner.
Yes, I can't wait we probably won't be on a stage, we'll be on something else 20 years from now talking about this, and can't wait for that. Well, thank you all. Appreciate the time and the conversation today. And as we wrap up here, this kind of brings us to the end of day 2 of the StartUpHealth Festival stage program. We highly encourage all of you to join us in the pavilion. I know probably we've all been down in the exhibit hall. The energy down there is incredible. You'll be able to meet all of these individuals directly down there as well. And we will be back here at 10 a.m. tomorrow with some more conversations. Thank you, everyone.